I think overall there were three things that emerged, and actually two of them happened in the meeting, and one of them actually happened kind of adjacent, but at the same time. So I think probably the the most promising and the most interesting study that came out was the FIGHT study, which looked at an antibody called Trastuzumab. And this is an antibody that targets FGFR2 beta. So it's a novel target in esophagogastric cancer. It's certainly established in several other cancers. But this was a randomized phase 2 study that looked at this antibody in combination with FOLFOX in tumors or in patients who had FGFR2 B positive tumors. So the positivity was defined either by immunohistochemistry of the primary tumor or positive circulating tumor DNA for FGFR2 beta amplification. Based on their screening, about 30% of tumors that are HER2 negative fit these criteria, and the majority of the tumors actually had protein overexpression without the ctDNA positivity. This actually was originally designed as a phase 3 study, but subsequently scaled down to a randomized phase 2 study. And it actually met its pre-specified endpoints, which were relatively generous in terms of confidence intervals. The primary endpoint was investigator-assessed progression-free survival, which was improved. Overall survival was improved, and response rates were improved as well. So again, I think this is important proof of principle, and certainly the investigators are now advocating for a phase 3 study. And I think if the results are confirmed, certainly it would be an additional target that we would have in the first line setting, and that would sit along HER2 therapy. There's now also an established role for the addition of immunotherapy in tumors that are PD-L1 positive, and so potentially this could be a third target for patients if a phase 3 study is conducted and if ultimately it's positive. But certainly it's the identification of a new target, in esophagogastric cancer that's exciting. The second study that I would talk about is a study that looked at ZW25, and this is a bispecific antibody against two different epitopes of HER2. So it's essentially Trastuzumab and Pertuzumab on one molecule. And we've seen previous data from this at ASCO, I think approximately 2 years ago, but they presented updated data, both of ZW25 on its own, but also in combination with chemotherapy. And it really reinforces that this is an active drug. In a treatment refractory setting, the response rates were almost 40%. So there are also ongoing studies of ZW25 in combination with FOLFOX chemotherapy in the first line setting, and immunotherapy or immune checkpoint inhibitors is also being added to the mix. So I think this really comes on this really indicates that anti-HER2 therapy has suddenly become an area that that's exciting and promising after essentially a decade of negative studies in esophagogastric cancer. So, to wit, the last thing I was going to discuss again happened adjacent and at the same time as GI ASCO, but Trastuzumab Deruxtecan, which is an antibody-drug conjugate of Trastuzumab with a strong cytotoxic drug, was approved, I think it was on Friday, for patients with HER2 positive disease who experienced previous progression on Trastuzumab-based therapy. And this FDA approval was based on a Japanese study. There was a randomized phase 2 study in the third line setting. So the approval is notable because it was based on no U.S. patients, but certainly the data are extremely compelling. There's certainly not a strong concern that there are ethnic differences. But the approval of Trastuzumab Deruxtecan really is only the approval of an anti-HER2 drug in esophagogastric cancer, and the first approval in a little bit more than a decade. So I think in totality, I thought these two studies and one development represented kind of the most exciting events to happen around GI ASCO.